Doctors in Manitoba are scrambling to contain an unprecedented spike in syphilis cases. Winnipeg's Regional Health Authority reports more than 120 cases have already been documented in the first 6 months of 2018. Now, that's more than the annual total for the past 3 years. Joining me from Winnipeg to explain why this is happening is Medical Officer of Health, Dr. Reimer. Doctor, thank you for being here.
Thank you so much for having me.
From 2008 to 2011, there were about 12 cases of syphilis reported each year in Winnipeg. From 2015 to 2017, that number rose to about 120. We've already seen that many cases in 2018, and we're just over halfway through the year. Why the spike?
Well, the problem that we're seeing is that the bug has moved into a different population. So normally we'd be talking about men who have sex with men, and that's the main group that typically we would talk about when it came to these outbreaks. But this time we've seen it move into a much more vulnerable, inner city, poor, largely Indigenous population who have a lot of structural barriers and things that are going to make it easy for this bug to take advantage of that population and spread very easily.
Okay, so that's the why. What's being done to address the problem?
So there's a couple of things. First off, we need to continue to do the same things we always do in public health. So that's tracking down people who have syphilis, making sure they're treated, finding out who their contacts are, and making sure those people are tested and treated. But this time, because it's people who are really hard to reach, who are not well connected to healthcare, we actually have to go a bit deeper and figure out what's the cause, why are the groups vulnerable like they are. And so we've been doing a lot of partnering with Indigenous organizations and poverty organizations. And if we don't start looking at the causes, we're just going to end up chasing our tails and trying to catch up all the time.
And this isn't just in Winnipeg. Rates of syphilis infection have been on the rise across the country. From 2010 to 2015, StatsCan reports that rates surged more than 85%. Why is the infection proving so hard to fight? I mean, I remember when I was growing up, we were bombarded with health information on in magazines, on television, scaring us into safe sex. Is that the issue? Have we as a society dropped the ball in terms of education?
I think people typically know a lot about how to protect themselves, but one of the bad outcomes of a good thing is that now that a lot of these infections are very treatable, people are a little less scared of them. So HIV used to be a terrifying thing, and now it's more of a chronic disease that people can live a long and healthy life despite having the infection. But the bad side of that is that if you're a little less scared of getting those infections, you're less likely to protect yourself with things like condoms or regular testing and treatment. So what our message is that if you're having sex, especially without a condom, then you're at risk of infection and you should get tested. Because if you get regularly tested, most of these infections we can clear with treatment, and the ones that we can't, if we catch them early, we can prevent the long-term problems and the complications.
Dr. Reimer, thanks. We know that you've got a big task ahead of you. We wish you the best of luck.
Thank you so much.